So just a quick explanation, plantar fasciitis tends to be caused by a area of deepness area right down here where there's an inflammation in the plantar fascia. It can be caused by a tight Achilles tendon that contributes to it. Sometimes people have heel spurs. I always say about 50% of the time someone has heel spurs and 50% of the time they don't. Heel spurs aren't usually the problem. The problem normally is the inflammation down on the bottom of the heel. And something that's difficult for people to understand is that all these muscles in the back of the calf, they all insert into the foot. And so if they're not working well, you're going to get inflammation down here on the bottom of the heel, especially at this insertion point of the posterior tibial tendon right here, which is very close to the area of the plantar fascia. That's why so many doctors recommend working out the back of the calf. Let's go and learn about the treatment process. This is what we're going to go over today. This is what I find that works for about 90% of my patients, works very quickly and efficiently, and hopefully it'll help you. So in phase one, I try to do three things, and only three things. I want to reduce the inflammation, reduce the tightness, and correct the heel alignment. We're going to go over that today, how we do all of those. In phase two, we try to reduce the inflammation and reduce the tightness with some different modalities, and then in phase three we go on to surgery. Very rarely do we have to go into surgery. There are a lot of other things that can help people. So what are the things that work most? Let's go over these top three things. I always like to explain that patients come in, and you're probably going to your doctor because of the inflammation, because of the pain you're having. You don't even know that you have tightness in the back of the calf, and you don't know that your heel is out of alignment. So let's look at this. So how do we reduce the inflammation? I find most people try icing, like with a bottle of water before they come in. They try anti-inflammatory medication, they try rest. When someone comes to see me, the first thing that I do and I recommend is a cortisone injection. This reduces the inflammation really effectively and really quickly on the bottom of the heel. If you have to get one of these injections, it'll probably be on the inside of the heel, right along this area. If that doesn't work after doing about 3 of those, then we can go to doing something called a platelet-rich plasma injection. This is actually where you spin down your own blood and you take the anti-inflammatory components of the platelets and inject it in there. And then also we can do a walking boot to reduce the pain on the bottom. This is all guided at working at reducing the inflammation on the bottom of the heel. The next step is to reduce the tightness. And tightness is one of the bigger causes in a lot of people when they come in and they're in pain, and we can reduce the tightness. I find what works best is deep tissue massage, utilizing trigger point tools, which are something like this, the block and the ball, or the grid foam roller. Both of these work very, very well. Most people, before they come and see me, they try stretching. I don't even recommend stretching because most people try it before they come and see me. I usually recommend these tools first. If that doesn't work, then I go on to physical therapy with a technique called the Graston technique, and then possibly we'll throw in there a night splint or Dynasplint. This isn't my first line of therapy. I find that these work much better. First thing out of bed, do the trigger point tools, works better than sleeping all night with this night splint. Stretching I leave at the end. Don't even usually recommend it. I like the deep tissue massage. I find I have much more effectiveness with that. And then the third aspect is to correct your heel alignment. I'm not putting people in inserts to give support in the arch. I'm trying to correct the heel alignment. If the heel alignment is off and people are flattening out, that's putting a lot of extra strain on the muscles in the back of the calf, and it's also putting strain on the plantar fascia. And so first, try a supportive shoe, like an Asics or a New Balance. You're looking to pay about $100 for a pair to get a good pair. If that doesn't work, you do orthotics. That's what works best in my hands. I would say in about 90% of the patients, people get better with this treatment. If you only give an injection and you don't work the back of the calf, the tightness, or correct the heel alignment, a lot of times the pain doesn't go away or it comes right back. Some of these other adjunctive therapies that help people sometimes, once again, this isn't the first line of therapy, but an air heel gives more cushion on the bottom of the heel, takes pressure off the heel. Also, the plantar fascial sleeve. This is like a compression garment or compression stocking that helps for a lot of people with their pain. As well as a last resort, we go to the topaz or a plantar fasciotomy. These are both surgical procedures. So I hope this helps you understand better how to treat heel pain. This is how I'm going to be treating it the year 2015, and as things change, I'll put a new update on here.